If you've been dealing with back pain, disc bulge, sciatica, and you've heard about spinal decompression therapy, maybe you're wondering, does it actually work? Or is it just another expensive treatment that overpromises and underdelivers? In this video, I'm gonna break it all down. I'm gonna show you what spinal decompression really is, who it actually helps and who it doesn't help, what the research says, and why it works best as part of a system. Let's dive in. Spinal decompression is a non-surgical therapy designed to reduce pressure on the discs and nerves in your spine. It gently stretches the spine using a computer-controlled table. The stretch creates negative pressure inside the disc, which can help pull bulging material or herniated disc material back in place and rehydrate the disc. It's not traction, it's not stretching, it's a specific targeted mechanical unloading of the spine. The goal is to relieve pressure, restore space, and allow healing to begin. Spinal decompression can be incredibly effective for the right person. If you have a disc bulge or a herniation, sciatica or pain that radiates down the leg, degenerative disc disease, back pain that's worse when sitting or standing, numbness, tingling, or weakness in your leg and foot, chronic pain that hasn't responded to physiotherapy, massage, or medication, you might be a great candidate. If your pain is sharp, shooting, or nerve-like, and if you tried the usual things without lasting relief, then spinal decompression might be what your body actually needs. But it's not a magic cure. It won't help everyone. It doesn't fix instability. It doesn't replace strength training. And it's not right for people with certain conditions like fractures, multiple spinal fusions, or severe osteoporosis. That's why we always start with a proper evaluation to find out if it's a right fit for you. Let me give you an example. A patient named Scott. He came to see us after dealing with sciatica for over a year. The pain, it shot down the leg. Sitting at work was unbearable. Walking became a struggle. He tried medication, rehab, stretching routines, even considered surgery. Within 8 short weeks of starting spinal decompression, along with laser therapy and guided rehab, his pain dropped from an 8 to a 2. And more importantly, he got his life back. He was walking again without fear, sleeping better, and finally, he was able to golf and play baseball again. That's what we aim for. Now, let's talk about the evidence. Spinal decompression isn't just a theory. It's been studied in clinical settings with very promising results. One study published in Pain Practice showed that spinal decompression led to a 90% success rate in reducing pain for patients with chronic disc issues. Another review found that improvement in disc height, nerve function, and pain levels across multiple trials. It's not just hype. When done properly, on the right patient, it works. Here's the catch. Spinal decompression works best when it's part of a larger integrated plan. That's why we use our BackStrong program. It's a framework, a 6-part non-surgical system designed to correct the real problem, not just mask symptoms. Let me walk you through each part of the BackStrong system. S, spinal decompression. This one step, we gently relieve pressure on the discs and nerves. It's often the first time patients feel relief because they are finally addressing the compression at the source. T is for therapeutic laser for the disc and nerve healing. We use a class 4 laser therapy to calm inflammation and accelerate tissue repair. It increases circulation, reduces swelling, helps injured discs and nerves heal faster. It's completely pain-free and often used by many pro athletes and hospitals. R is for receptor and shockwave stimulation. Pain shuts down your stabilizer muscles, the ones that support and protect your spine. We use specific stimulation like shockwave therapy to wake them back up and break down scar tissue so you can move confidently again. O is for orthopedic support and spinal mobilization. Your feet, your posture, your pelvis, they all impact your spine, We use custom orthotics when needed and gentle mobilization to restore proper movement and alignment. If your foundation is off, your back will always pay the price. And nutritional fuel for disc repair. You can't out-treat chronic inflammation. We provide simple, targeted nutritional advice and supplements to help reduce inflammation, support disc hydration, aid regeneration, and you don't need to be perfect, but small shifts matter. G is for guided rehab. This is where long-term change happens. We guide you through a custom rehab to retrain deep stabilizers, rebuild confidence, and prevent future flare-ups. No more flare-ups, rest, repeat cycles anymore. So yes, spinal decompression opens the door, but everything that follows helps the patient truly recover and stay that way. Before we wrap up, let me quickly answer some of the most common questions I get about spinal decompression. Does it hurt? No, most people find it relaxing. You lie comfortably on a table and the machine does the work. Many people even fall asleep during a session. How long does a session take? Each session typically takes about 20 to 25 minutes. It's efficient and easy to fit into a busy schedule. How many sessions do I need? Well, that depends. It depends on your condition, your age. Some people feel relief in just 6 to 8 sessions. Others need a full course of 24 to 30 sessions to get lasting results. We customize the plan based on what your body needs. Is it covered by insurance or benefits? Yes, but it depends on your provider and your specific coverage. So does spinal decompression really work? Yes, when it's used in the right way, for the right condition, as part of the right plan. If you're still living with back pain, sciatica, or disc problems, and nothing has helped so far, it might be time to try something different. Give us a call at 519-227-1363 to schedule a BackStrong evaluation for yourself. We'll assess your condition, listen to your story, and let you know if decompression is the right avenue for you. If this video helped, please subscribe and share it with someone who needs to hear this information.